We are all connected through shared experiences, and while our circumstances may vary, there is almost always a common thread in our stories. I am Amy Seaman, and these are the stories that connect us.
Hi, friends. Welcome to another episode of A Common Thread podcast. I am your host, Amy Seaman, and today I have with me Ivy Emery and Andrea Zimmerman, the dynamic duo behind Harmoni Wellness, or as I have started calling them, my clam squad. Because they are quite literally the team that is putting Humpty Dumpty back together this year. So welcome.
Yes.
May is International Women's Health Month, so I really wanted to bring them on and have this conversation. Before we get into it, why don't you each just give a quick background on who you are and how Harmoni Wellness became to be?
Absolutely. My name is Andrea Zimmerman. I'm a women's health nurse practitioner, board certified. I live in California. My business is in Minnesota. I've spent my entire nursing career treating women from labor and delivery, IVF, and actually just full scope OBGYN. Ivy and I met in graduate school. I travel to Minnesota once a month for about 10 days to see my patients in person, our patients, and then I provide telehealth care when I'm back in California.
Yeah, and I'm Ivy. I am a board certified women's health nurse practitioner, and I'm really excited to be here, and I'm really thrilled that you invited us on to celebrate Women's Health Month.
Yes.
The more we learn about women's health, the more empowered our community becomes, and it's really a beautiful moment to be in women's health.
Yes. I feel like I am of the age where anytime I am in a room full of women, the conversation always turns towards our health issues. Like, does it not?
Yeah.
I mean, truly, it's like that is the party talk anymore.
Yeah.
And so I feel like we are not alone in this struggle. The struggle is very, very real. And the more that we know, the more we do feel empowered. I can say with full confidence, and I touched on this in a previous solo episode, but you two have truly changed the trajectory of my life. And so I'm so thankful for you, because I was on such a downward spiral for years and I didn't know where to turn, and it became so overwhelming that I did nothing. I froze and I did nothing and I suffered. And so if you're listening, I just really want you to take away from this that, like, please take action. There is help out there and there are things that will make you feel better. We do not just have to suffer through this. I certainly waited too long, and I think part of it is I just didn't know. I was young. I started having what I now know are perimenopausal symptoms at 38. And I just didn't believe it because I didn't know what it was. And so I remember one night laying in bed, and I rapidly started gaining weight. And it wasn't even, we talked about this earlier, it wasn't even weight, it was like inflammation. Like I just started swelling like a balloon, and I was so uncomfortable and everything was so puffy. And I felt gross. I felt so gross. I was having horrible night sweats. I was just chronic fatigue, the brain fog. I mean, I have terrible memory to begin with. I think it's part of my ADHD, but like the brain fog became so bad that I felt stupid. And so I remember one night laying in bed and just like Googling all my symptoms at once. And what popped up was this local naturopath. And so I thought, okay, I'm going to start here. And so I spent over $10,000 in testing and supplements, and I was taking handfuls of supplements every day. And while some symptoms were improving, it really wasn't a significant return on investment. And I remember in one of my follow-up appointments, I kind of said, could it be hormones? Because at this point, people started saying to me I overshare on Instagram. And a lot of people would say, well, it might be perimenopause. And I was like, do not come at me with that geriatric shit. Like, I am 38 years old.
Right.
I don't even know what that word is.
Yeah.
What is this?
Sounds gross.
It does sound gross. And I didn't know the difference between perimenopause and menopause. And so when I went back to my naturopath, I kind of said, could it be some hormones, perimenopause? He goes, well, we can look at hormones. I do have another colleague I can refer you to. He specializes in hormones, but his theory is there is no perimenopause. You're either bleeding or you're not. And so I took that at face value and was like, okay. And so I didn't pursue it. So let's debunk that first of all. Can you just kind of define perimenopause, and like when does it start, and how do we know that it's starting? Like, what are some early warning signs that we could start to like go, okay, I need to go see someone for this?
I love this question. Do you want to start or do you want me to jump in?
I want to just take a moment to acknowledge what you said. It really is the most meaningful thing to us to hear personal stories and how we've impacted people's lives. And People are struggling. And I remember when we first talked, you were asking for help. You were seeking everything. You were so invested in your health, but you were hitting all these dead ends. And sometimes those dead ends and those barriers for women, when they're trying to caring for children and caring for older parents, and they're developing their career and they're doing all of these things that are important to their life, when they're hitting dead ends, when they're asking for help, it's not just one day. It's not just, oh, the next day I'll go find another specialist, or it could set you back months or even years. And this is why we opened our clinic, is because we wanted a safe space. We wanted to disrupt what the current status of care is. We wanted to normalize conversations. So I'm so thrilled that you're having us on, because I know we're going to talk about all the things. But yes, go ahead. Perimenopause.
I was just going to say, you are not alone. We receive very little information about the changes that are coming in our late 30s, early 40s, what to expect in our 50s. Perimenopause, we know, can begin in your late 30s.
Yep.
Absolutely none of us are prepared for that. We don't get education about it, so you're not alone. Women barely understand what is about to happen and when it's happening, what it really means. The men in our lives get absolutely zero education about what's happening, and so it's a time where your body is changing. The symptoms that you have in 1 month could be different the next month. And so it's very difficult for the individual woman to understand what in the world is going on.
Yeah.
We know that women will see, on average, 7 to 8 different specialists. What's going on with my heart palpitations? Why do I have brain fog? Why are my ears ringing? Why does everything hurt in my muscles?
Sleep, anxiety.
Sleeping, mental health, before anyone mentions hormones. So there really is, it's just not widely understood yet, and the information isn't widely dispersed yet for women to say, maybe I'm going to look into hormones now. Yeah, instead of waiting until they think menopause is an old woman's issue. It certainly can't be menopause.
Yep.
We need to do a much better job with educating women broadly so that they can be prepared and start getting education and information about what to do with their body.
Yeah. Because the list of symptoms for perimenopause, they're 60 something, right?
Which means there's over 100 combinations, because everybody's perimenopause might look different.
Yeah.
So when you're saying that people are commiserating and they're talking about their symptoms, there are some common things, but there are some really wild things too. So, and then like Andrea says, it comes and goes. And so when women are asking for help, they can't put the words to what it is or the timing of it, and it gets very confusing.
Yes, and it's like, where do you start? And, and you sit down with your primary, which is where most of us do start. And I think that one thing I know as I've been sharing my journey with working with both of you, the first question I always get asked is, do they accept insurance? So I want you to touch on that too. But you go to your primary, you get the labs, they come back, they're within normal range, and they do nothing. And they tell you to de-stress, and they tell you to, see a sleep specialist, and they tell, all these things. And it's like, again, it's hard to know what symptom is feeding the other symptom. What is hormones, what maybe isn't. I do have ADHD, and sometimes there are some overlap in there, but I have found that my ADHD has been exacerbated since I've been going through this, which I just recently learned. Like, you can actually develop ADHD during perimenopause. I've never had it before. And so, and to your point about husbands, I mean, my husband has been incredibly supportive in just like, I don't even want to say allowing me to go on this journey, because he's not one that would ever stop me, but he's just, okay, who are we seeing now? And I remember when I came home from meeting with you the first time. So I had an initial consultation with you, Ivy, and I was in your office later that day. You're like, I have an opening at 2. I was like, I will be there. Like, we've got to talk more. I'm coming in. And I came home so excited, and I told him, and he goes, oh yeah, this is going to be the thing. And it just like immediately took the wind out of my sails. And I know he didn't mean it in that way, but he had seen over the last several years, I went through having my breast implants removed because I thought I had breast implant illness, which I do still think was part of a factor of it. And I had spent all this money on the naturopath. And so he'd seen me, and I did these extreme dieting and, exercise changes and all of this, and like nothing worked. So he's been, 5+ years, he's been watching me go through. So he's like, oh yeah, here it is. Here's the next thing. And so I do think that like having that awareness as a male is really important. And I know you guys are doing some speaking to groups of men as well. So ladies, play this for your husbands.
That's right. That's right.
Yeah, if you think you're confused, your husband doesn't have any idea what's going on. And so it's a new landscape for everybody. But to your point, I think it just speaks that women, they're not messing around. They're really trying to get to the root of the problem. It's just really difficult for them to find someone that will sit down and take the time and explain, this is why your body is changing. Here are some things that could be coming. And then here are your options.
Yep.
They're really trying to solve the problem. It's just difficult for them to find a provider that can spell it out for them.
Yep.
And provide relief.
And that's covered by insurance. Why is that? Why is that so difficult to get insurance to cover some of this?
Well, we had a long conversation about how our model of care, how we were going to be able to reach as many people as possible. And insurance is a really big barrier for that. When we talk to women, we want to approach it in a holistic manner. So if we're going to talk to you about a leaky bladder, we're going to talk to you about how it affects your mental health. If we're going to talk to you about low libido, we're going to talk to you about how it affects your mental health. And because it's a whole body experience, perimenopause anyway, we are talking about symptoms through the whole body. So it gets really complicated when we're coding, when we're trying to get reimbursement. And we decided that we didn't want to surprise bill our clients. They think they're going to call the insurance company, they're going to say it's covered, and then we proceed, and then it's only part covered.
Yeah.
So then we come back with a surprise bill. So we thought transparent pricing, we will absolutely provide bills that have, or receipts that have ICD-10 codes on it. We'll provide any other information that insurance companies need, but we can't take on that communication with the insurance company. So some people have used our services. They're able to use their FSA and HSA, and or they have submitted to their insurance company and gotten some reimbursement. But at least it's, oh, I'm getting some money back, instead of, what, I owe so many more dollars. So
Okay.
it's a different model of care.
Yeah.
It's a different approach to it. So it's not that we don't take insurance, because like I said, we will work with folks, but we just don't have the capacity to work with the insurance company.
Yeah. And I do appreciate how transparent you are on your website with pricing, because I've had, we'll get into all the different procedures and technology that you guys have and things that I've used. And I always get, well, how much does it cost? Like, number one, how much does it cost? And so I just am able to send them a link to your website where the pricing is just outlined right there. And I think the one thing too that I've really come to realize is it's time and money that is a barrier for a lot of women, but we are worth investing our time in ourselves. And I'm hoping that through my transparency, I can help kind of shorten that time frame for a lot of women of getting to the right person. I've tried so many different things, and so getting to the right person will save time. Also, we are worthy of investing in ourselves. And yes, it might mean sacrificing other things, to do it. But like our health, if we don't have our health, we don't have anything. And I think that is so worth the investment financially and in time.
You know what's so interesting? We are the barrier to making ourselves the priority.
Yeah.
If you had a child or someone else in your household and they needed a treatment, they needed to see a special doctor, we do that for our family members.
Yes.
We do that for our children. We would not think twice.
Yeah.
Somehow we've put ourselves and our self-care so far down on a list of priorities.
Yeah, you're right.
That's up here. And that's something that we need to convince ourselves we are worth investing in ourselves, our own health, and feeling good in our own bodies really is a priority.
Yeah.
And I almost feel like it's a phase of life you come around into. You kind of decide, oh yeah, I am also important. I am going to invest in my well-being and feeling good in my own skin.
Yeah, because I wasn't showing up as my best self. My energy was super low, and I'm still working through that. Irritability, I could just turn on a dime. Like the littlest things would just set me off, and I wanted to nap all the time. I was at a point where my kids would get on the bus and I could go back to bed for 2 hours and still be tired.
Oh, exhausted. Yeah.
Yeah.
So we were talking about the common things that we hear in our practice. And I would say that it is, I don't feel like myself.
Yeah.
And whatever symptom shows up, that impacts the individual, and that's what drives them to come into us. No matter what it is, it's like, whoa, this didn't used to happen to me. I didn't used to function like this. I used to cope better. I used to sleep better. every time I move, I'm reminded about this midsection weight gain and bloating, and I just don't feel like myself. Low libido. I don't have a connection to my sexuality anymore. That doesn't feel like myself. It's so unsettling for people because not only are they coping with the symptom, but it's also like I've lost a connection with myself. I feel like I'm a shell of a human being sort of walking around. And sometimes, I have joy or what have you, but it certainly does come around to I don't feel like myself. And we kind of joke sometimes that we wish we had insurance coding or medical coding for meh.
Yeah.
MEH. I feel meh.
Yes. Yes, that is so true. Yes. And when you don't feel like yourself, it impacts how you're showing up. It really does. And I think for me, a lot of people, when I finally started, it's like when you start gaining weight, let's talk about that. When you start gaining weight, I'm a person that feels like I need to address it right away because obviously everybody's thinking it is what I think, right? So I feel like I need to talk about it and I need to address it. And I had a lot of people go, I never even noticed you don't look like you've gained any weight. And it's because I know how to dress my body type. No matter what my body is, what size I am, I have that skill set that I can dress it to where other people might not notice as much or still think I look great. But I felt so insecure, and I'm not an insecure person, but I did feel really insecure at times when I would see pictures and videos. And so, when we were doing all the testing, it's like, where do we start, right? So we were looking at hormones, and it is kind of a bit of a trial and error, right? To figure out, is it estrogen? Is it progesterone? Is it testosterone? Is it, what is it? So talk about how do you start to like figure out what hormones are missing and how do we balance those out?
Yeah, well, we know that there are some symptoms that are hallmark symptoms for certain hormones. So if someone is coming in with severe hot flashes, that is just calling to me that we need some estrogen on board. Okay. If someone is coming in and they are really struggling with sleep, I'm really thinking a lot about progesterone. If someone is coming in with low libido, I'm really thinking about testosterone. And some of the hormones play smaller puzzle pieces in that. And so it is really nuanced, especially with our perimenopausal folks, because maybe it isn't estrogen right now. Maybe you're good with estrogen and maybe you need more progesterone in part of your cycle. So it takes a lot of digging and talking. And that's our model of care is we want a robust intake. And then we want to make sure that we're following up. But even in between those follow-ups, we want to make sure that we are having proactive, let's do a phone call. Let's see how you're responding. Did you have any questions? So really a supportive and hands-on model of care. I think also empowering people to know their own selves. They really get to know their own bodies, what their symptoms are, what their hallmark symptoms are, that our clients feel pretty comfortable reaching out to us to tell us.
You guys are like pinned as one of my favorites. I'm like texting you all the time.
Well, we welcome that though, because we never want our clients to feel like they're on their own.
Yeah.
They're just not sure if this is right. Hey, this has never happened. Troubleshooting. We really do want to take good care of our patients, and that means caring about them and following up. Insurance would not allow us to make multiple free phone calls through the weeks to catch up with patients, but we feel like that's the way women should be cared for. A lot of women have some hesitation about, okay, I'm going to start hormones. I hope this is going to work. I hope this is safe. And I think holding their hand and talking them through and touching bases with them frequently really allays a lot of their fear. It gives them even more education about their bodies along the way. And we want to empower them to ask for what they need. This was working for me 6 months ago. It's not working as well for me right now. What can we tweak? You betcha. We're going to do that. This is about how you feel. And so that's why it's an hour-long visit. Yeah, insurance doesn't really want to support that business model, but that's how we feel like it should be done. So that's
hormone replacement therapy. Is it safe for everyone? Are there some women that maybe it's not a good option for?
The old thinking 20 years ago was that if you give a woman hormone replacement therapy, she's going to wind up with breast cancer. Maybe she's going to have a cardiovascular event. And almost all women in the United States were taken off of hormone therapy in the early 2000s, and that hasn't changed until very recently. The good news is the data supports that bioidentical hormone replacement is safe for most women, not all. Bioidentical hormones are not the same medication that was used 20 years ago. The medication has become more sophisticated over time. We value doing a deep dive into a patient's health history, both her family history and her personal history. And that's how you make the determination of, is hormone therapy right for her?
I think it's confusing when we talk about hormone therapy too, because there are different types of hormones and different ways that we use them, and there are different safety profiles. And so a lot of the menopause champions, these are like the Dr. Havers and Caspersons and Fonda Wrights, all these folks that are in the community serving women, putting out new research, sharing research, books, podcasts, movies, all the things. So they are really pushing for more education for women to understand the hormones and how there are different options, not to group it all into one thing and then just, it's not for you.
Yep.
So we could talk about, vaginal estrogen is different from systemic estrogen, and there is a robust safety profile for vaginal estrogen. It is appropriate for nearly almost everybody. And yes, we have to be careful with systemic estrogen, but still it's an option for a lot of folks. And depending on how we give it, if it's oral or through the skin, there's even more safety profile in there with that and different reasons why we use that. And then there's progesterone and different deliveries of that. And then there's also testosterone. So you can see how it's very different. And when we combine it all together, it can be rather confusing.
I remember you said, so I'm on the vaginal estrogen. I started with an estrogen patch and then I was gaining weight. Remember that? I was like, I called almost in tears.
So
I was like, I cannot afford to gain any more weight because yes, I felt even more bloated. So we stopped that right away. I am on the vaginal estrogen cream. And I remember one of you said like every woman should be on this and they get to be a certain age and you're on it kind of for like, we talk about why that is. So, I mean, I'm like, okay, great. Let's keep her looking good, but why?
I do joke and say every woman should get a tube of vaginal estrogen on her 50th birthday, and that's a forever gift. You need to keep refilling it for the rest of your life. And the reason is because the tissues of the vulva, the vagina, the urethra, the neck of the bladder, all of those tissues are rich in receptors for estrogen. They're waiting to be filled with a little drop of estrogen, if you will. And while our ovaries are making estrogen for us, those receptors are full. And those tissues are allowed to be nice and thick, plush. They're full of collagen, elastin, blood flow. They're able to moisturize, lubricate, stretch, and feel comfortable. Without estrogen, the integrity of those tissues change. It thins out, it dries out, it loses its ability to stretch. It can become dry. It can feel like it's burning, itching. But beyond how the sensation is, women start to experience urinary tract infections much more frequently. They're unable to have penetrative intercourse. And then they lose control of their bladder. That's a basic function. We taught our kids to potty train when they were toddlers. And then you lose the ability to control your own bladder. And that just gets worse the more the integrity of the tissue is lost. When you apply a vaginal estrogen cream, it literally puts the estrogen right back so the tissues can soak it up. And you want to apply that a couple times a week as long as you'd like to have control of your bladder. Yeah. That's a basic function. But as long as you would continue to like to have a vagina that's comfortable, that isn't bothering you every day, you don't want to have to think about it. Right. So that's the use of the vaginal estrogen. And it is not absorbed in a significant way throughout the whole body. It really stays local. And so we do prescribe it to every woman who's 50 and over. Some of our patients that are younger have it too. Yeah. Some patients we give the prescription and they're like, I used it, but I don't really think I need it yet. And I say, that's fine. Just know the purpose of it. At one day in your life, you're going to revisit that and you want it. Yeah.
And we can give it the vaginal estrogen cream. We can give it with systemic estrogen. So it doesn't affect the blood levels. It doesn't raise the blood levels. So we can do those together. And then they work so beautifully with the genital urinary system. What we sometimes call it is the chef's kiss. I know that talking about incontinence, I was thinking, what are the least sexiest words? Incontinence and osteoporosis. Yes. But these are some huge passions for us because this actually can be preventative. And so every woman that we're talking to, we're thinking about, I'm looking at you now and I'm thinking about you when you're 75 years old, 80 years old. We want you to be feeling vital. We want you to do the things you want to do. And women are coming to us saying, I want to be 20 again. They're saying, I want to maintain my function and my independence for as long as possible. So we know what happens to women. We have the data that cardiovascular disease becomes the #1 killer of women over 50. Osteoporosis is a real concern. And those are preventative fractures that can happen to people. And then subsequently, we know that it can take 2 years off your lifespan if you have a fracture after 50 years old.
Yeah.
I mean, this, and not to mention the pain and the mental health issues when we start to have a decline in our health. So it's symptom control. It's also preventative for future.
Mm-hmm. While we're on the bladder topic, so this is one thing when I was having my consultation with you, Ivy, I was going through my list of all my ailments. And I brought up my bladder. Maybe you asked me about my bladder or something. And you said, well, we have a solution for that. And I was like, what? Because I have not had control of my bladder since I can remember. I mean, I'm in my high school yearbook for peeing in the hallway my senior year. Like, most embarrassing moment by a senior, I peed in my hallway because I was laughing so hard and I had a skirt on and there was no stopping it. And there was a puddle by the lockers, and I went sprinting to the bathroom, and I had a girl in my swim team because also my whole swim team always knew that when I would get nervous, like standing on the blocks, I would always pee right before race because I'm like, whatever, I won anyway. No one's gonna know. It's so gross.
Poor thing.
And so she came running back there. Aldrich, was that you? I'm like, get in here. Don't say anything. Go get my keys. Go to my car. I had to change of clothes, luckily, because I was a swimmer. And then I remember they had to have someone stand around the puddle of urine to make sure nobody tripped in it before the janitor came. I mean, I have just dealt with it for so long. I always find humor in the madness that I just had to laugh it off. But that doesn't mean that it doesn't really affect me many a times. I mean, there's been times I've been out at a bar with friends and I peed my pants and I've had to go home early. You know, it's stuff like that. So talk about this, the V-tone and the Forma V that I've been using, because I can tell you that I would say I'm like 85, 90% improvement from where it was. Like, I can go for a walk now without leaking, and that is huge. I would go to the bathroom. I would go to the bathroom before I would go on a walk, and I'd be down the block and it would start leaking. And I'm like, how do I even have any more fluids in me?
You know, this is so common, and I'm so thrilled. I'm so thrilled the treatments worked for you, and they worked so well. This is actually how Harmony started. Andrea was doing this work in California, and I saw her talking about it on social media, and I reached out to her and I said, what is this magic? Because we always have to circle back to mental health. We always have to think about, it's annoying, it interferes with our life, but then it's also like, I'm constantly thinking about, am I gonna have an accident? I need to be by a bathroom. I have to leave a meeting several times. We've had clients report the urgency and frequency, and they have male colleagues, and it's just like, okay, I'm sitting in a meeting and now I have to excuse myself twice during an hour meeting, and it's embarrassing. And we just wanted better for women. We just thought, we don't want the brain damage, just the constant having to think about it, and pads, and what am I wearing, and now I only wear dark pants, all these things. So it's really, really common. And I told her we pretty much just have Kegels. We do have some really lovely pelvic floor therapists in the community, but historically we haven't been utilizing them.
Yeah.
And
I did go that route, and I did not, and I shared this with you, I did not have a great experience.
Yeah.
When I did a little bit of physical, I actually did 2 sessions, and I felt so uncomfortable that I was like, I'm not coming back anymore. And you know, Kegling, you're like, am I doing it right? Is it making any difference? And then that's one more thing you got to think about on your skincare routine. And then I gotta also be Kegling while I'm blow drying my hair. That's what they told me to do, because it's while you're standing.
But then women will report too that they they don't do it, so they're bad. Like, I'm not good at doing that, so, and I forget all the time. And so that puts the onus back on women. Like, it's another thing I'm failing at.
Yeah.
And then also that if it's not working, because we aren't taught proper Kegels.
Yeah.
Normally, usually. And when they're doing them and it's not working, they're pretty convinced there's something wrong with them.
Yeah.
And then it's kind of strange because in our culture, we talk a lot about it. Like, we say laughing and leaking. People go, oh, I know what that is, right? And we openly talk about it. And like you said, it at parties, and I've heard people mention it, but we still don't talk about it. Like, we're kind of sure that there's either something wrong with our anatomy and our person that causes mental health issues.
Yeah.
And it's a ding in confidence.
Mm-hmm.
So we wanted to fill a gap in care and offer another option. Pelvic floor therapy, the therapists are amazing, but it isn't for everybody. We do have some folks that have come to us after they've done pelvic floor therapy, which is great because then they know how to identify the muscles in their pelvic floor. And then we do our treatment as sort of the top off. So there's a lot of ways that we can either work together or our treatments is working for them. We always want to consider the vagina because it really turns out vagina is really important.
Yeah.
It's not just for babies and intercourse.
Yeah.
It's tissue that needs to be healthy. It needs blood circulation. So, considering if someone is having incontinence and even if they're young, do they need vaginal estrogen perhaps? And we think about our postpartum friends too, that are definitely having estrogen suppression, trying to nurse for years, that kind of thing. And then they're really uncomfortable. So we can help them too. But we also have vaginal treatment. So we were talking about the two treatments. And so the pelvic floor issue, we really want to get to where is the incontinence coming from? Is it more linked to a vaginal lack of estrogen? Is it the pelvic floor, which is a muscle, several muscles. It's actually a basket of muscles, but it's a different approach. And if we can couple those things together, then sometimes we can really get over the hump, but sometimes people only need one or the other.
Mm-hmm. So talk about this technology, the Forma-V and the
Vitone and the Forma-V. They were specifically designed to deliver treatment on tissue. And that's a difference than what our pelvic floor therapists, they're wonderful to help patients understand how to train the muscle that exists and strengthen things. What we're working with is the actual tissue, trying to increase the integrity and strengthen the integrity of the tissue. So the devices are placed inside the vagina, and radio frequency is delivered with a V-tone in a 360-degree manner, which is bathing and communicating with any muscle tissue that's inside the pelvic floor, causing a contraction, and then it relaxes in another contraction. And the vaginal estrogen is helpful if patients have had estrogen deficiency because it's going to allow them cells to become a healthier, stronger cell in themselves. And then you come into the office and you get a treatment and strengthen them. So I think of it like you don't go to the gym and just work out as hard as you can. You have to work up to that strength. You have to warm up those cells, and then really we can dump a lot of energy into those tissues and make them work out really hard.
Yeah.
Once you've had a therapy like that in our office, you can feel your pelvic floor working during that treatment. It's much easier for patients to go home and then isolate those tissues when they do their little pelvic floor exercises. I do mine when my coffee is brewing.
Yeah.
I have to stand there. There's nothing else I can do. I might as well do my Kegels.
Yeah.
My pelvic floors.
Yes.
So it does give women the awareness of, oh, that's what I was supposed to be activating when I was doing those pelvic floor exercises. And so we have patients come in and do those treatments once a week. The Forma-V is a stronger, more targeted bladder incontinence therapy that we use. Yes, it can give you increased sensation during intercourse. We don't talk about that a whole lot in our clinic. Ivy talks about that a lot in the clinic. I have a real passion for ending this bladder incontinence issue for women. I know it just gets worse as we age, and I really want to stop it and empower women to ask for help. Like I don't want to let this just continue in my life. It does dictate what you wear. It dictates how long you can slide.
Well, and you pointed out too that I had like a minor prolapse bladder. Like she was falling out, and I was like, what? I am 41 years old, and all I could think of is my 96-year-old grandmother who has this similar issue. And I'm like, I'm 41. But, and for me, and here's the other thing too, that I just want to share. We've talked about this before, but like I go full throttle in my treatments. Like we have to go all the way to the back. So I'm like, is this okay? Like, is something wrong with me that it takes the full, to go all the way up to the full volume for me to really feel the contractions? But I think it's because I've been dealing with this for so long, or whatever the issue is. And I've had 8 treatments now. And typically I think we started with like, 3 to 4, and I'm on 8. And so if it takes you longer, and if you have to turn it all the way up, like that's okay. There's nothing wrong with you.
Here's something positive to focus on. This May, your oil change can actually help change lives. At any Apple Autos location, when you get an oil change, they'll donate $1 to Hope Chest for breast cancer, up to $10,000. It's called Get an Oil Change, Give Hope, and it's one of those simple things that makes a real impact. Apple Autos has been supporting Hope Chest every year since 2011, and the work they're doing is so important, providing financial help to local breast cancer patients for housing, transportation, even basic daily needs. And the best part? You don't even have to leave your house. Apple Autos offers free pickup and delivery for oil changes, so it's easy to do a little good while taking care of your car. Go to appleautos.com and schedule your oil change today, because every mile you drive can help someone else keep going. For years, I struggled with symptoms I couldn't explain. What I now know was the start of perimenopause. My general practitioner missed it. My naturopath missed it. I spent over $10,000 on testing. I tried every supplement Instagram threw at me, and still nothing worked. But I refused to give up, because this is not as good as it gets. Then I found Harmoni Wellness. One consult literally changed everything. I was in their office that same day, finally feeling seen and heard. I started hormone replacement therapy shortly after, and for the first time in years, I feel so much hope. If you are struggling, please hear me. You are not alone. Your health is absolutely worth fighting for. Schedule a free consultation with Harmoni Wellness today and take the first step toward feeling like yourself again. You are worth it. I'm in what I like to call my Pam Anderson era. I am simplifying. I'm trying to embrace my natural beauty. I'm trying to strip down to the basics. But let's be real. I am not Pam Anderson, so I wasn't getting quite the same results. I realized that the biggest miss was in my skin. It was looking dull, tired, I had a lot of sunspots, broken capillaries, fine lines, wrinkles. Basically, just years of neglect were catching up to me. So I went to Infinite Youth Med Spa, and after a quick consultation, they recommended Moxie plus BBL laser treatments. I've had just 1 of 3 sessions so far, and I cannot tell you how many people have commented on how much I'm glowing. It's the kind of confidence boost that I don't think I really knew I needed. What I love about Infinite Youth is that they never made me feel like I needed anything. They just listened. They get that we all have our own insecurities, and they help you make the right choice for you without overdoing it. If your skin is feeling tired, if you're looking to simplify, trust me, the best investment you can make is not in makeup, it is in skincare. Go rebuild your confidence at Infinite Youth Med Spa and tell them A Common Thread sent you. I can snap a mirror selfie of my outfit of the day with full confidence, but the second you point a camera at me, I totally panic. Suddenly I'm questioning everything, like where do my hands go? What kind of face am I supposed to make? Am I attempting to look serious and sexy, or am I laughing off to the side at something hysterical that's not even there? It just feels uncomfortable. But Professionally has completely changed the game for me when it comes to professional photos. Their photographers instantly make you feel comfortable, guiding you through poses so you never feel awkward. Plus, their playlists always set the perfect vibe the moment you walk in the door. You will be dancing your way through that photo shoot in no time. And if a little liquid confidence helps, Prosecco is served as part of the package. I'm just saying. You might know them on Instagram for their signature pink backdrop, but if bold colors aren't your thing, do not worry. They've got neutral options too. Professionally was designed to make professional photos painless and accessible with quick turnaround times and sessions as short as 15 minutes. So if it's been 5 years or more since your last headshot, consider this your sign. Book now at profeshii.com. That's PROFESHIE.com. And don't forget to mention A Common Thread.
That's okay. There's nothing wrong with you. I did have one follower who reached out. She started this after I had shared. And she's like, Amy, I feel like I could ask you this, but she's like, they went all the way up and I still couldn't feel it. Like, am I damaged down there? And I was like, no, like we just need to normalize all of this. That everybody's sensitivity down there is probably different. The tissue is probably different. The stage they're at is different. But
That's really true. I actually didn't share the numbers with people for a long time, but then I thought, well, fine, okay, I'll share it with you, because it even varies from treatment to treatment.
Absolutely. Like sometimes I can feel it right away, and sometimes I don't feel it till we're already up into the 30s. Yeah. But no, it definitely, it has been such a game changer, truly. I had a pessary, which I've talked about many times. And you had said, Andrea, you're like, that's not a long-term solution for most people. It's not something you should have forever. But I just thought, well, this is as good as it's going to get. And there are times where like I would have my mom, I'd be out at the bar and remember that I forgot to put it in. And I'd be like, Mom, can you go to my house and get it and meet me at the bar with it? Because it was like a safety net for me. Like I just felt so much more secure if I knew that I had it in. And it wasn't bulletproof. I could still pee right through that thing if I really got going.
Laughing.
Yeah,
truly.
Well, I want to talk about the form of V, because the form of V is the one that is radio frequency. It's a tiny wand we put in the vagina, which lots of ultrasound gel. It doesn't hurt. Both of these treatments don't hurt.
Discomfort when it gets crampy, but
yeah. And then there's no downtime. So
so when I leave, I don't feel anything.
Exactly. So the form of V with the radio frequency, and we're placing that on the tissue. It's putting the energy in through the tissue. So we're stimulating that blood circulation that we were talking about to keep those tissues nourished. So it's deeper in the tissue, so you're not going to bleed after. It's not like having vaginal bleeding, but it's going to continue to keep the tissues strong, stimulate collagen. It is the lubrication, and then the incontinence piece. We can focus it more around where the urethra is on top of the vagina, so we can focus it there to get some more structure. And then, yes, the sensation for her. It's one of the only things that we have that's sensation for her. So we do have quite a lot of folks that, you said we probably asked about laughing and leaking. We probably did. We are definitely top of mind, laughing and leaking, libido, vagina. We want to talk about things that people typically aren't perhaps asking about, and so we directly, pointedly ask about it. And vaginal health is really important. We have a lot of folks that report, and this is so common, and the more women that we talk to, it is really, really common, low libido. They just don't have a connection to that sexual self. And our culture, the way I explain it is with clients is I'm like, there is the connection to your partner. There's the relationship. If there's a libido mismatch and he's wanting to and she isn't, that's a mismatch, which can cause some challenges. There's function. Does it hurt? Nobody wants to keep doing something that hurts. And we've heard clinicians advise, why don't you have some wine then before you have intercourse then, instead of give some vaginal estrogen, like let's get to the root problem. The more you use it, then you don't lose it, that kind of thing. And that's really sad. So anyway, we want to know about libido. We want to know about function, and we know that it dings confidence. So when I kind of circle, because sometimes people maybe aren't in a relationship, or maybe they don't have a relationships that they're invested in right now to be sexual with their partner. But the libido piece and having that connection to your sexual self or not having that connection is unsettling. It's one of those things.
For sure. I don't feel like myself. I feel like I've always been a very sexual person, and over the last, I don't know, however many years, as my body was changing, it wasn't feeling good. My drive has gone way, way down. And then I feel this like, so I don't even know if I want to say guilt, but kind of, like I feel like, well, I didn't want my husband to feel like I bait and switched him, like, and, all of a sudden now we're settled in. And I also think I dismissed it for a while because vacation Amy can turn up. Like she wants it morning and night. And I am always like, oh, well, it's still there. But then I get home into my everyday life and it's like, I could go weeks and not even think about it. But I feel like if you go more than 1 week without sex, then it feels awkward. So then I was doing maintenance sex, you know what I mean? And it's like, that's not where I want to be because it doesn't feel, I'd lost that sense of self, right? And so when we came in and you started asking about that, I was like, actually, my libido is really low. And it does take me longer to get off now than it used to. And so we talked about testosterone, and I got on that. And now I'm finally at a point where I'm like, ooh, like I woke up the other day, I was like, babe, I woke up horny. Like I can get into it once we get going, but to actually wake up horny, I was like, oh, I haven't had this feeling since the 90s. You know what I mean? Like,
She back.
early 2000s.
She back.
You didn't lose her. She was buried a little bit, but it's like just coming into your own.
Yeah.
Like yourself and your own skin, and that's what we're going for. We're not trying to turn women into something that they're not. We just want them to feel the fullness of themselves.
Yeah.
And if you don't have the foundation of the hormones in your body that you enjoyed from the time you hit puberty, you don't feel like yourself.
Yeah.
And it's okay for women to want to connect with that part of themselves.
Right.
And it absolutely affects our relationships.
For sure.
I had a patient yesterday. She hadn't been able to have relations with her husband for 10 years because it was so painful. And we did start her on testosterone therapy. She walked in. She looks great. And I asked her, how are you doing with the vaginal estrogen? How do you feel with the testosterone? And she lit up and she said, I'm having sex all the time. I can't believe it. I said, what does your husband say? She said, he knows better than to say anything. She's enjoying it. She said, even better than the sex, which is great. She said, I have that connection for sure.
Yeah.
It's like we're a partnership again instead of, I don't want to live with a roommate. I want my relationship, that one person that I chose in my whole life.
Yeah.
And this is the only person I can have that connection with, and it was broken.
Yeah.
And now it's back.
Yeah.
That intimacy.
Absolutely.
And I thought, if that isn't the reason why I want to come to work, I know what is. This is what we're trying to do for women, is give them their lives back. So they can live their fullest.
Absolutely.
Whatever that is for them.
We want to be really thoughtful too, because some people have really sweet relationships and they feel fully connected and they're not interested in intercourse. And it's other things that they want to do, and they hold hands, or they just have this, that they're feeling fulfilled.
Yeah.
And so that's great. If there's not an issue here, there's not an issue. It's when there's a libido mismatch, or the woman is saying, hey, I'm not feeling like myself. I don't recognize myself. Those are when we want to intervene. So we usually always talk through it to understand where that individual is. We offer options, and usually hormones do more than one thing. So sometimes.
Right. And testosterone also helps with like drive and motivation and things like that as well. Right. So I remember when you first said that, I was like, because I think we tell ourselves stories, right? So I struggle with consistency. I struggle with motivation. I get really overwhelmed and I go into freeze mentality. And then you start to tell yourself, I'm lazy. I'm just intrinsically unmotivated, things like that. Or I'll have an idea and I'll go, oh, well, Amy, you're never going to finish that. So don't even get it started. Like these are the stories that we tell ourselves. And I remember when you said it can help with drive and motivation, I was like, maybe it isn't me. Maybe it is a hormone imbalance that is causing me to feel so stuck. Like I always say, I feel stuck. Like I can't move myself forward at times. And so I'm noticing that as I've, like climbing out of the basement, because when we did my labs, my testosterone was pretty low. And so that validated that, like, it's not that I don't find my husband unattractive anymore. It's not that I'm, dried up and brittle. It's not that I'm lazy.
It's not over forever.
It's
biology.
Yes.
Look at it.
And so as I started to we're working on figuring out the right dosage, and I start to feel differently, those things are coming back to life again. And it feels so good. It really does.
Yeah, it's
It is definitely a game changer.
And it finally gives women the opportunity to stop beating themselves up. When you were just describing, we are so quick to blame ourselves and judge ourselves and throw ourselves right down the staircase with, how could you have done this to yourself? It's all your fault. It couldn't possibly be your body changing.
Right.
It must be that you're just, lazy.
Yeah.
And women walk around with this messaging in their head. If I could only get it together, if only I could push myself a little harder, if only I was a harder worker, if only I could really focus, then I wouldn't be struggling this way. Well, there's just so much more to it.
Yeah, a couple things about that. I mean, we go back to women will see 7 to 8 specialists before they get to the root cause of what's going on. And it makes sense because it's a full body experience, including mental health. And so there are a lot of things that, if you're talking to specialists, they need to rule out certain things, but it is really puts the onus on women to accept everything is normal, because that's the lab show, everything is normal. And then you just move on with it. So women are asking for help, and yet they're stuck, and they're taking that responsibility on themselves. And our culture is sort of backing that up. It probably is you. Maybe you could do better.
Yeah.
And it's not a good message for women. And I think that, clearly when our women thrive, if we can get to a root cause, symptoms start to go away. It's not a magic bullet. It does take other work for lifestyle changes and things like that. But then people are more motivated. They get positive outcomes. It perpetuates more positive action, and they're supported. Then our community does better when our women are doing better. Our families do better when our women are doing better.
So let's talk about the tirzepatide that I'm on. What's the difference between GLP-1s and semaglutides?
Semaglutide is a GLP-1. It's the original. It was researched and developed to help type 2 diabetics with insulin resistance and glucose control. Insulin is a hormone. When insulin is out of whack, all of our body systems and our other hormones start to get completely out of whack. That's the root cause of PCOS. So anyway, it's a drug that was developed to help diabetics, type 2 diabetics, with their blood sugar. And while type 2 diabetics were using it, they noticed that they were able to lose weight in a way that other medications had never helped them. And over time, it became a very popular drug to help with people that wanted to lose weight. It's sort of a miracle drug, though, in that the side effects are generally pretty pleasant. People feel less inflammation. They feel less pain. The food noise, there's a new phrase that's come out in the world because of the side effect of GLP-1, which is the quieting of the mental noise and the messaging that we constantly have not all of us, many of us have in our brains about food. What are you going to eat? How much did I eat? When do I eat again? Did anybody see what I ate? What do they think about about me based on what I just had? How much more can I have? Have I had too much? What am I going to have tomorrow? I ate too much today. I can't do that again for the rest of the week. Constant messaging, food. What are my kids going to eat? What am I going to eat if they're eating this? Can I eat any of that? Just constant nuts. And when that voice is quiet, you are then able to focus on what you're going to do today. A project you're working on, right? About that vacation I was hoping to plan. What am I going to do with my partner tonight? All the things that have to do with our life have nothing to do with what we put in our mouth. So it allows people to feel well. They feel comfortable. They're losing weight, which is usually a positive. They're able to control their blood sugar, which is difficult for many people to do. And it just is like a snowball of good things. We're seeing a reduction in diabetes, hypertension, cholesterol, glucose is under control, anxiety is lessened, inflammation and pain in the body is lessened. We're people who have addiction issues, we're starting to see research that people who are addicted to substances or behaviors, we're seeing them pull away from those addictive behaviors. So it's still a classification of drugs that are new enough that there's a lot of research that still needs to happen, but we're seeing so many positive things come from it that it's just become an extremely popular medication. Semaglutide is the original. Tirzepatide is a second generation. Liraglutide, there's a new one, retatrutide. So companies are putting a lot of money into investigating how can we make these more and more sophisticated to be effective with fewer and fewer adverse side effects. So that's why you're hearing a lot of noise about these medications. They're trying to find the even better, less expensive, how can we treat more people kind of medication.
Well, and I think too, when it first came out, there's still a lot of stigma around it, and I think part of that adds to that is this, the wellness influencers. I keep seeing videos of some of these like young wellness influencers who are like, that's just lazy. You need to do your diet and your exercise, and really shaming people that are on it. And it makes me so angry because I did all of those things. I went on insanely restricted diet for 6 months. No gluten, no dairy, no grains, no chicken, no beef, because I had developed herpal antibodies towards them, we found, because you can do that when you eat foods too much or whatever. And I mean, I was eating the cleanest I've ever eaten. I could hardly eat anything. I had to bring coolers of food with me when we would travel because I knew most places that there was like nothing I could eat. You know how much weight I lost in 6 months? 0. Not even a half of a pound. And when I tell you I stuck to that diet 100%, I did not cheat because I was like, I need to get this weight under control.
Sure.
And lost 0 pounds. So talk about discouraging.
Yeah.
And, and you hear this, and I was going to hot works and doing the infrared sauna workouts and I'm moving my body. But when we did labs, it came back. I had insulin resistance. I was like a 0.3 or 5 away from being pre-diabetic. And I thought, well, to me, I would think pre-diabetic are those who don't really pay attention to what they eat and don't move their bodies enough. And that's false, And so to see that, again, it felt so validating of like, it's not, no matter what I do, it's not going to improve without the help of these medications. And when the first week that I took the tirzepatide, I had lost 4 pounds and we were all like, well, that's too much. But then we realized it's water weight. I was carrying so much inflammation in my body. we were talking about this before we started, looking at the video of my podcast that I recorded back in February. I saw that today and I was like, wow, my face was so swollen and round and puffy, and to just be able to see like a jawline again and my eyes again, it does help with my confidence significantly. Yeah. For me, and you mentioned this, Andrea, for me, it wasn't so much about the scale, the numbers. I didn't feel comfortable. I felt so puffy all the time. And so this has been amazing for me because I finally feel like it was the thing that I needed to help. I'd wake up in the middle of the night starving. And I'd have to get up and go eat something. And I don't want to be eating something in the middle of the night. I'm sitting in bed angrily eating crackers and it's dry. And it's like I'm trying to be quiet. You know what I mean?
Angry eating.
It's like the insulin was, my blood sugars were not regulating. Yeah. And I have people we talk about this too. I have people who said to me, oh, you didn't need to lose any weight. You're not fat. You didn't need to take this. And I thought, I know you have good intentions, but that's really not helpful because I didn't feel like me. And also then I feel like I need to go into my whole health history. So then I start going into, I had insulin resistance and I was almost pre-diabetic and whatever. And it's like, why do I have to defend that? So I think let's just be mindful of how, when someone is sharing openly what they're going through, or you notice that they've lost a lot of weight, there could be a lot of medical things that were going on. That's not just a vanity issue, right? Or it's not me trying to fit back into my size 2'4" that I, was for most of my adult life.
Well, we find that too with our clients. Most of the people who are approaching us have tried everything.
Yeah.
They are invested in their health and they are not looking for a quick fix. A lot of them have already been working out for 4 days. So now they're working out for 6 days and they're like, well, now I just have to work harder and harder. And then I have to restrict calories more and more. And they really need to reset everything. They just need a break. Mm-hmm. They need a tool that's going to give them some positive outcomes to continue to do what they're doing and to reevaluate how they're doing it. So they're not stressing their body out so much. We definitely want to see too, is there an underlying cause? Is there an opportunity for hormones to be supportive? Because we know with decreasing hormones, we're going to have increasing sugars, we're going to have decreasing lean muscle. So those kinds of things are going to keep rolling toward an outcome that we don't want.
Yep.
So is there an opportunity to support folks to make those changes and give them a break from the food noise, give them some positive outcomes as they're moving forward? Because the goal is, when we're looking at a client, we're thinking, you want to come in for GLP-1s. How are we going to get you off the GLP-1? That is the first thought. So what is the sustainable outcome? And that's going to be.
So what does that look like? But
Coming off of it?
Yeah.
Well, I think it varies. There is some research that says people who needed the GLP-1s to maintain their metabolism and correct the insulin resistance will need to be on a dose forever. There are other people who will taper off of it and they're able to maintain their muscle strength, they're working out, they're very conscientious about their nutrition, and they can maintain their weight loss because they maintained their muscle strength and because they worked out, those muscle cells are what you can rely on to gobble up all your blood sugar and keep the calories that you've eaten, you burn them off. And so then you're not gaining the weight. There are some of our clients who are not interested in losing any more weight. They are not struggling with nutrition. They have always been an active person, and they're choosing to stay on a very low dose of the medication because it quiets the food noise and it removes the anxiety piece from their lives. And they're so much more comfortable using the medicine than worrying about what they're going to do now that they're off. Yeah. And so all of those things are unique to the individual. We really pride ourselves on trying to understand what the goal of is for the patient, and helping her get there and maintain, but know that life changes. You have to stay flexible with some things. Sometimes the goal that women walk in the door with is very different 6 months later. Yeah. Many of our clients come in with a number in mind of where they'd like to be with weight loss. And I counsel them from the beginning, this number probably represents the last time you felt really great in your skin.
Yes, it does.
And I want you to feel really great in your skin no matter what the number is. That's just kind of random. So if that number changes as you're feeling really good about yourself, I don't want you to feel like you haven't reached your goal. If the number is a higher number, but you feel great, then, good on you. Let's talk about what's next for you. That's what I'm going for with clients. And it's like, I wanted to say that most of our clients are already very well-versed in nutrition. Most of them are working out most days of the week in a varied amount of ways. It's lifting, it's Pilates, it's running, it's biking, it's being with their families. They want to be really present every minute. And sometimes the weight is a chemistry issue. It's not a lack of effort issue. Or a lack of education. So really looking at the client holistically is super important.
And I think with, a couple of things that you guys always talk about is like, when you're on this, you really need to make sure you're getting enough water, enough protein, and lifting weights. And that's one thing that getting a lot of protein is difficult for me, and I'm still trying to be mindful of it. I feel like I've always done a pretty good job of water, and the consistency in lifting, but those, just knowing that just makes it feel easier for me though. If those are the only three things I have to really worry about, actually that simplifies it for me than to think about all the different things, right?
It's overwhelming.
But I'm going to share this story because we were talking about this. I'm going to talk about my story last night. So constipation is a negative side effect of this, and you do really have to stay on top of it. And the last couple weeks have not been regularly taking what I normally take at night, the Colace or whatever, just stool softeners and some laxatives. And 2 days ago, I had this thought of I don't know when I pooped last. And I did nothing with that information. I just had the thought, and then I moved on to my day. And I was in yesterday, and we were talking about it. I mentioned it, and then 2 days ago, and then yesterday was horrific. I was so constipated. I was in the bathroom for 45 minutes in the morning. And when it comes halfway out, and it's we're stuck in the middle. You can't go in, and it's not coming out, right? And you're just stuck there. And I'm sweating, and I'm not sure if I'm going to vomit or faint. And I'm afraid I'm going to tear this thing wide open. And so then I finally got to a place where I could you could laugh at this. Yes, no, but you know what? It was I would rather give birth because at least I had a support system in there with me. Nobody is in here with me. I'm in my pink bathroom. At least it's pink, and I'm this is my happy place. And I'm fighting. You're fighting for your life. I am fighting for my life. I'll never forget it. So then I sucked it back in. I went on for my day. I was drinking all kind of my friends bringing me the Smooth Move tea and these other probiotic things, and I'm doing the essential oils in my stomach, and I'm we're gonna get something going. And then a few hours later, I was I felt like I had to go again. Same thing. Another 45 minutes, nothing was coming out. I was pacing in my bathroom with my pants off, trying to just maybe if I walk a little bit, it'll go one way or another. Nothing. I finally call my mom, and I'm in tears at this point. And she goes, I'm going to go to the store, and I'm going to get you a suppository. And I'm bringing it over. And I go, I don't know that you can get anything in there. What else can fit in here right now? It's so black. So she's just figure it out. Go upstairs, Amy Marie, and figure it out. And so I did. And then 30 minutes later, same thing. It was another hour, but it finally, I was dilated to a 10.
I know, you're laboring down.
Oh my gosh. And I was and then you get done and you look at yourself in the mirror and you're what the fuck just happened? We are now. Like, this was my entire day. I had to move meetings. It was so bad. So let this be a cautionary tale, ladies.
Yes.
Stay on top of it because it is awful.
Water, fiber, moving your body.
Yes. All of
You
it.
have to stay on top of it. Try to stay ahead of it. Because dealing with it when it's happening, it's a cautionary tale.
It is. Oh my God, it was awful. Anyway, well, let's end on that note. Thank you both for all that you do in the community. You're always hosting events, trying to just continue to educate and inspire. And like I said, you have just been, I feel like I will cherish you forever. Even when I'm off, I feel like I'm still going to have you on speed dial to just check in. I love you both so dearly. And I thank you for all that you've done for me. And if you're listening and you're local, go see them. They're in Plymouth. They have a beautiful spa. It just feels so inviting and warm. And they feel like fast friends that you could just tell anything to. So thank you for all that you're doing.
Thank you for your trust.
Last question that I always ask everyone. What is one common thread that you believe connects us all as humans?
I think as much as all of us are really so alike, we all have our unique quirks. And I like the idea of leaning into that, giving women the confidence to understand that that's what makes them unique.
I love that.
And finding that in the people around you and really celebrating that is the joy in community, really finding that uniqueness and letting your friends lean into it.
I love that.
I think that it is everybody. I think that most people, almost everybody, wants to be seen, and even our introverts, more like heard, but like really seen. And I like now that in elementary schools, they teach kids that across the room, if somebody says something that connects with me, or that they do like this heart connection, and it's a silent way to acknowledge. Yeah. And then it gives more confidence to the speaker and they're heard and seen.
I love that. Beautiful. Thank you. Thank you, friends, for tuning in. Please do share this with anyone in your life, gentlemen or females that are going through this really fun phase in life. Until next time.